to introduce the next speaker, that is Dr. Marta Guasch Ferre. She's an associate professor, group leader at the Department of Public Health, and also at the Novo Nordisk Center for Basic Metabolic Research at Copenhagen University. She's also the deputy head of section of epidemiology at the University of Copenhagen, and also a adjunct associate professor at the Department of Nutrition at the School of Public Health. She's doing research on diet and lifestyle epidemiology using large-scale prospective cohort studies and also trials, also integrating on, particularly metabolomics, as a way to try to understand underlying mechanisms linking diets to these diseases. So please, Marta.
Thank you very much, Dr. Landberg, for the introduction, and Dr. Rikard and Stephen Pieper and all the organizing committee for the opportunity to speak here today. So Alexa, what should I eat? I don't think Alexa knows what should I eat. I don't think any of us know 100% what should we eat. But certainly, after all the studies that have been presented by some of my colleagues and others that are ongoing, probably the nutrition field is going towards that direction, knowing, or better, having precision nutrition strategies to know exactly what each person may benefit more than other things. So today, in my talk, I'm gonna speak a little bit about nutritional metabolomics approaches, some of our work related to identifying metabolomic signature of the Mediterranean diet and plant-based diets, and also about extending a little bit, not only on diet, but also on other healthy lifestyle factors and the risk of mortality. So as you know, traditionally, nutritional epidemiology has mainly focused on looking at the relation between exposures and diseases. However, in the recent years, or maybe not that recent anymore, but the past 10, 15 years, the scientific community is leading the efforts to a more systems epidemiology approach, in which several fields collide to try to integrate all the information that we have in trials, but also in prospective cohort studies, with novel omic techniques such as metabolomics, genetics, and microbiome. And the reason for this is in somehow to understand better the biological mechanisms behind these associations between dietary patterns and diseases, but also to identify, as my colleague Clemens recently briefly explained very well, they identify novel markers of exposures and also diseases. Briefly, metabolomics is more time sensitive than other omics, so maybe, or not maybe, but we know actually that it's more affected by nutrition, but oral environmental factors, and integrating these metabolomics with prospective cohort studies, with randomized trials, could help us to better stratify individuals, to identify these diet biomarkers, and also to have more therapeutic prediction with the final goal to improve precision nutrition. Several studies have been conducted, pharmacokinetic studies, feeding trials, associations in prospective cohort studies, to try to identify dietary biomarkers or metabolites that are affected by different factors, including, for example, some trigonelline has been identified as a marker or potential marker of tea and coffee, proline betaine as a marker of citrus. Also, there have been other studies showing some markers of nuts, but it has been a little bit more difficult to identify metabolomic signature of more complex dietary patterns. But we have been, during the past years, trying to combine this metabolomics data in trials and prospective cohort studies with nutrition, and then see how these metabolomic signatures can also predict the risk of diseases. So one of the papers that was led by my colleague, Jun Lee and Liming Yang at Harvard School of Public Health, used data from the PREDIMET trial that I guess all of you know already, and then Harvard cohort that have been presented before by my colleague Santi Malik, Jordi Merino, Clemens, I think, also talking about it. So these large prospective cohorts to try to identify a metabolomic signature of a Mediterranean diet. So what we did here is combine a plasma metabolomic more than 300 known metabolites with a Mediterranean diet adherence using a score. And then when we had identified this metabolomic signature, we tested the association with the future risk of cardiovascular diseases. So briefly, we used machine learning methods, and we identified the metabolic signature that consisted of 67 metabolites, including some amino acids, glycerophospholipids, some carnitines. And this metabolomic signature measures adherence and metabolic response to this Mediterranean diet in Spanish and US populations, then we saw that there was actually a robust correlation between this metabolomic signature and the self-reported adherence to a Mediterranean diet. And some of these metabolites were biologically plausible. For example, there were several metabolites related to seafood intake, such as lipid markers that contain long-chain omega-3 fatty acids. Metabolomic signature, we tested the association between the future risk of cardiovascular diseases, also using the PREDIMED study and the Harvard cohorts, and this metabolomic signature was inversely associated with the risk of diseases. And then we conducted some Mendelian randomization analysis that showed that the genetically inferred metabolic signature was also associated with coronary heart disease and stroke, providing some causality in these associations. Along these lines, as you know, plant-based diets have become very important, are very well known for the benefits on health, but of course we can have healthy plant-based diets and unhealthy plant-based diets. And in this paper that was led by the postdoc Fenley Wang in Franco's group at Harvard School of Public Health, what we did is identify metabolomic signature of both overall plant-based diets and healthy plant-based diets and healthy plant-based diets. And we identified that there were some metabolites that were actually overlapping between the healthy plant-based diets and the unhealthy plant-based diet, but there were also some unique multimetabolite profiles that differ significantly across these diets. As you can see here, it was for a healthy plant-based diet. We identified that some metabolites were associated with these healthy plant-based diets, such as higher levels of trigonelline or epurate, while others, such as isoleucine and triglycerides, were inversely associated with this healthy plant. And then, similar to the paper before, we tested the association between the metabolite profile scores with type 2 diabetes, independent of other risk factors, and there was actually an inverse association. So the result from this work supported the beneficial role of healthy plant-based diets and provided new insights into which pathways are actually affected by healthy plant-based diets and the role that this could play in the incidence of type 2 diabetes after several years of follow-up. And then, as I mentioned before, very recently, and as part of an NIH grant that I was the PI on circulating metabolites, healthy lifestyle, and mortality, we wanted to extend a little bit this research and not look only into diet, but onto a healthy lifestyle score. And this paper was led by my postdoc Julie Tessier at Harvard School of Public Health and published in Med a few weeks back, actually, so it's quite recent. And what we did here is first using the Harvard report, the Nurses' Health Study 1 and 2, and the Health Professional Follow-up Study with more than 10,000 individuals. This has been presented before. We created a combined healthy lifestyle score that included a healthy diet, measured alternative healthy eating index, physical activity, never smoking, moderate alcohol, and normal BMI. Combine this with the same metabolites that I was briefly mentioning before, and then replicated the results in the Women Health Initiative. So briefly, we first conducted some metabolome-wide association analysis, so trying to see the association between this healthy lifestyle score and each of the metabolites, adjusting for several confounders, and we identified 58 metabolites, including cholesterol esters and plasmalogens, that were associated with this healthy lifestyle, and on the contrary, 129 metabolites that were inversely associated with the healthy lifestyle. So in other words, higher levels of the blue ones were associated with an unhealthy lifestyle, and the ones in pink were associated with a better lifestyle. Then we performed some elastic net regression models to identify metabolites a little bit more agnostically of this healthy lifestyle score. And we identified 101 metabolites that were associated with the healthy lifestyle score. And these metabolites were consistently or quite consistent with the ones in the previous analysis on the metabolomic associations. As you can see here on this graph, this showed good correlations between the healthy lifestyle metabolomic signature and the self-reported scores, both in the discovery populations, but also in the replication populations. And importantly, among all these lifestyle components, the metabolomic signature was most strongly associated with actually having the normal BMI and a healthy diet. So that was the components that were probably driving most of the association between the metabolomic signature and healthy lifestyle score. And then we tested the associations of this identified metabolomic signature with the future risk of total and cause-specific mortality. So what we saw is that this healthy lifestyle metabolomic signature was inversely associated with total mortality, cardiovascular mortality, and also cancer mortality. And importantly, these associations were independent of the self-reported healthy lifestyle score. And in some of our mediation analysis, we show that the healthy lifestyle metabolomic signature actually attenuated this association between the self-reported healthy lifestyle score and all-cause mortality, and explain about 38% of these associations. So in brief, as a conclusion of our work, but also others, I think nutritional metabolomics could be complementary rather than replacement of other dietary assessment methods, and that reproducible, sensitive, and specific dietary metabolomics biomarker can be used to validate self-reported measures of diet, to provide objective biomarkers of adherence to dietary interventions and dietary patterns, and improve the prediction of future risk of diet-related diseases, and facilitate personalized or precision nutrition. Finally, I would like to acknowledge all the authors of the papers that I have presented, from the Nurses' Health Study, the Dietary, the Predemet Study, and my group, of course, the University of Copenhagen. And as a take-home message, I want to leave you with the thought that using these metabolomic signatures, we were able to identify a metabolomic signature of a Mediterranean diet and a plant-based diet, and that these metabolomic signatures were inversely associated with the risk of cardiometabolic diseases. We were also able to identify a metabolomic signature that measured adherence to a healthy lifestyle and was associated with mortality, and also I couldn't present it today for the sake of time, but with a higher odds of longevity. So thank you very much.
Thank you, Marta, for that excellent presentation.